The primary purpose of Uniquely Human, the podcast, is to educate and inform. The views expressed during all episodes are solely those of the individuals involved and do not constitute educational or medical advice. Listeners should consult with professionals familiar with each individual or family for specific guidance.
Uniquely Human, the podcast, is produced by Elevated Studio. Music is graciously provided by Matt Savage of Savage Records.
Hi, I'm Dr. Barry Prezant, clinical scholar, researcher, and consultant on autism and neurodiversity, and a Brooklyn boy raised in the big city.
And I'm Dave. I'm none of those things, and I grew up on a farm in Illinois. But being on the spectrum myself, I have plenty of personal insight to lend.
And this is Uniquely Human, the podcast, a show that illuminates and celebrates autism and neurodiversity. Today we have a very special guest on Uniquely Human, the podcast, and our guest is Dr. Felix Kreier. Felix, welcome to our podcast.
Thank you so much. It's such an honor to be in your podcast. Thank you.
Yeah. So just a little bit of background. I met Felix at a conference in September, this past September, and it was a wonderful conference in Maastricht, Netherlands, and it primarily was for healthcare professionals and physicians who serve children coming into medical settings. And Felix was asked to moderate and bring together a panel to discuss specifically how we can best support autistic children and neurodivergent children. So just a little bit about Felix, and then we're going to dive right into his great wealth of knowledge. Felix is a pediatrician at OLVG Hospital in Amsterdam, Netherlands, and he has a special interest in emergency medicine. He graduated in medicine in 2012 at the Amsterdam Medical Center of the University of Amsterdam, and he's also an instructor for procedural sedation at the Foundation for Pediatric Sedation in the Netherlands. And one other thing we're going to learn is he also has a PhD in neuroscience. So, Felix, that's a lot to unpack. Can you tell us a little bit about your history and why you chose a career in medicine?
Yeah. So the first time I was thinking maybe I should become a doctor was when I was about 5 or 6 years old. My mother sometimes had a panic attack. Then she would run to our general practitioner, our house doctor, and he would just grab her wrist and count her heartbeat, and then she was healed in that moment. And I thought that was really magic. But after school, when I finished high school, I had no idea what to do. So I did a lot of different things. I worked as a courier, I studied philosophy, I didn't finish the degree. I studied art history, I didn't finish it. I had a bar, I was a taxi driver, I was cleaning cars, I was a chauffeur, I was a computer manager. I worked at elderlies at home. And then I was 29 and I didn't accomplish anything yet. And just a small remark, now I know that I think that my emotional development was just a little bit different from other students. So I just didn't felt in that time what I should do. But when I was 29, I thought I want to become a doctor. And everybody was shocked and in panic because all my ideas before didn't work out. So, but I did it, and that was the best choice I could ever make.
That's excellent. And by the way, it sounds like you did achieve a lot by the time you were 29, far more than most people.
Yeah, what it really helped me. And when I look back now with my diagnosis of autism, I think I was in a safe way. I was kind of learning on the social field. I was learning a lot. I loved the job. I was at the airport in Amsterdam. I was cleaning cars. And that was with a group of people, and they didn't had a high school degree. And I always had a lot of difficulty to connect with them because my only way to connect was through facts and knowledge before. So that was the first time I had a lot of contact with people just hanging around. And they accepted me. And I learned a lot cleaning that cars. So if you hear like cleaning the cars, but it was an emotional development for me, it was really important.
Yeah. If you don't mind me asking, when did you get your autism diagnosis?
Yeah, it was quite late. So I didn't think about it for a long time. The only thing was that I never had the feeling I fit in. I always had the feeling I don't fit in. It
Mm-hmm.
was not really a big drama for me. But there was, looking back and how I feel now, there was a lot of stress because of that. I was thinking all day what I should do in certain situations, especially awake social situations. So I had all kind of tricks to be in not in wake situations. I had a lot of belly pain as a child because of the groups of the other children, and that was not easy. But I never thought of autism. And then a very good friend of mine, she gave me a book, and it's called, I think, if I translate it right, "The Boy Who Felt Too Much." And
Mm.
I have all kind of ideas about the book, but one thing, when I read it, and she said, "You really should read it. Maybe you will recognize something." And then I read it, and I recognized a lot of things. And first, I was a little bit kind of afraid or shocked. And in small steps, I accepted for myself that I could check it. So I went to my GP, and I got a referral to the psychiatrist, and they tested me, and it was very clear that I'm autistic, but I'm quite lucky. I think I can compensate a lot.
Mm-hmm. So, if you can give our listeners a little sense of what you do in your work, certainly, as we said, emergency medicine is a particular area of focus and interest for you, but you do a lot more than that. So, what's a typical day like for you at work?
Yeah, so our system is maybe a little bit different from the American system. So I'm a general pediatrician, and what I like, it's really broad. My work is very broad. So I start in the morning. It's very clear. You start and you end your day with the handover meeting, and then the team from the shift before will tell you what happened in the hospital. I'm working in Amsterdam, in the center of Amsterdam, in a general hospital. And then I have different kind of tasks like neonatology, emergency department, children's ward, and a lot of fun is outpatient clinic because I see, like, I think maybe 70-80% autistic children, which is a lot of fun. And I see them mostly with bodily complaints, like most of the themes is headache, bellyache, um, problems with urination and bowel movements, and sleep. That's the themes. And also the sedation unit. We see a lot of children, all kind of different children, but also a lot of neurodivergent children to get medical procedures, also from outside Amsterdam.
Hmm. So, the conference we both participated in uh, just a few months ago really did focus on partially what you're doing, seeing kids coming in emergency situations with medical issues. What do you find that you need to do or that you're able to do when working with a child like that and a family especially? Because they must be, in many, many cases, either quite frightened or feeling overwhelmed coming into the hospital.
Yeah, because I think, like, for example, with autistic children, there might be several things might be different. One thing is, I don't know if I can explain it in a clear way, but that feeling that everything is okay, that's something I never had. I also don't have it now. When I feel that something is okay, it's more because of logic arguments than a general feeling. So most children, they look at their parents, and I don't say that autistic children don't do it, but there's a little bit of a difference. So it's everything I tell now, it's not 100% because in general, it's all the same, but there are some different tweaks, some differences. The difference is that a neurotypical child, you can comfort with kind of a warm bath of emotions in simple ways. So mostly it will work. And then the child will think, I don't understand what these medical instruments are for, and this, why is that person screaming over there? But still, it should be okay. So that's might be different. That might be different for autistic children because maybe their safety is a little bit more from facts and from sensory inputs, the noise, the smell, what they see, the people they know, how it feels to sit in a certain chair. So everything is different. So a part of the safety in the beginning is gone already. Then they also might experience a discomfort because they're always in the emergency department because they are sick. They also might experience it in a different way. Maybe they don't really know what they feel, or they don't really know what to expect. And that may, yeah, these things are a little bit more difficult to them. And also because it is very, I mean, the emergency departments, they are always a little bit chaotic. So it's difficult even for me to predict what will happen next. That's also what we put a lot of energy in to try to make this day as predictable as possible and to explain what the steps will be in advance. So maybe these are some differences.
Yeah, that's so perfectly articulated, and in fact, it almost sounds like you're writing biographically about my own experiences, even now as an adult, but throughout my whole life, of any time that I've had to go to the hospital or anything more than just a routine doctor visit. And I also have a family member who is, afflicted with exactly what you're describing: the belly pain, the headaches, difficulty sleeping. And I think one of the things that happens is for people on the spectrum like us, there's this mental model that is established the first time we do something. And generally my mental model for something that is very unpleasant is a stronger, more rigid model that doesn't adapt much than pleasant experiences, right? So I don't know if it's like this for everybody or for the population that you work with, but I will say that the mental model going into these situations, you're, like you said, you're already starting in a position that is not conducive to healing. You go to the hospital to heal, and what is the first thing a lot of doctors do is they look for a problem to fix. And so now you're dealing with the patient's medical or mental model of, this is chaos. There's beepings, there's smells, there's, like you said, there's people wailing in pain 2 doors over, and you can't calm me down because my mental model tells me that people are not here at the hospital to go on vacation. They're here because there's a problem. But then the doctors come in and they're looking for the problem, and they start poking and drawing blood and squeezing, and it's all very fast and frenetic. And it's not an easy task. So I would imagine, Felix, having your personal lived experience probably informs how you are engaging not only with the patients, but then with the patients' families and trying to just get them through the experience.
Yeah, I think, by the way, maybe we can come back to that later, because that's going directly to the problem is also a thing in the outpatient clinic. But about the emergency department, so what we try as a team, we learned that a lot of damage can be prevented by preparing. So with every child I see in the outpatient clinic in a steady situation, there's no need for emergency treatment in the outpatient clinic. It's more like a visit, some belly pain, for example. Then the first time we always make an emergency plan, because we know that every child will end up in the emergency department someday. That will happen in the future. So we make a very small kind of letter, medical letter. And basically the letter only says like, this child is on the spectrum. listen to the parents. And for example, this child has an hyperfocus on dinosaur. It sounds very cliche, but some children, they like it. And this child, and it's so important just to ask, and also sometimes we walk with them to the emergency department in the stable situation where they don't need it to see it. And then just to ask them, what is important for you when you go to the emergency department? Very often they're very clear. So I have one boy, everything is fine as long as you don't remove the socks and he doesn't have to be on barefoot. Another child just never want to be touched at the head. So there are small things you can work with. And then you write it down. It's kind of a description how you should treat that parent, that child. And the most important sentence is listen to the parents. And then we write down our name of our hospital and tell, like, if you have any questions, call us 24/7. So no excuse not to listen to this letter. And we do it in English. And the parents can show it on the ED wherever they are. And we also ask them to play at home with kind of simple medical things like gloves or like having a mask or listen with stethoscope, and to do some play at home, like how this at the doctor. And then you see that it can be much, much more better. And what we also learned a lot is that if it doesn't work, we stop and we don't use force and rethink as a team, is it really necessary? And that's something which is helpful for all patients, because very often we see that it's not really necessary what we're trying to do when we really are critical. So it also helps to the care for all children, what we are doing.
So it sounds like there's a great level of awareness that by what you're doing, which, many doctors will think that this is my job, I need to do the poking and the prodding and the checking, that there's a heightened awareness of what you're doing may trigger a lot of dysregulation in the child. And that's just so important to be aware of that. And it's great that you document it.
Yeah, and it's so simple. It's really like 5 to 10 minutes. And parents feel really safe to have that letter when they go on a holiday and they can show it. And I'm wondering why parents very often are not believed in the first place, but that's still the culture how it is. And it's really so nice to see that a lot of things can be accomplished if you do it like that.
So I'm just curious, do you have children coming in with complaints of pain or medical complaints who are not diagnosed? And when you see the child, you say, oh, wait a second, there's something going on here, a little bit more than some gastrointestinal issues here.
Yeah, so that's the outpatient clinic. So our system is that you first go to the house doctor, to the general practitioner, and he will refer you to the pediatrician in the hospital. We don't have pediatricians outside the hospital. So I have my outpatient clinic. It's totally different work. And then they get to me after a few weeks on the waiting list, like we have a waiting list in the hospital. And then, for example, they have belly pain. And I really like this group of patients because it's so many positive things you can get out of it, and it's always a chance. But I will get back to the question because you asked if I see not diagnosed children. Yeah, quite often. So when there is in the age like between 10 and 14, very often there are issues on the social field, and on a regular basis you will find children which are autistic. And there's something interesting I noticed. I have no idea. This is just a thing I recognized. I don't know for sure it's real or it's other people experience it. With some children, I feel kind of an immediate connection. I don't really can explain it. And sometimes even I feel really stupid about it. Sometimes I had one boy, I was kind of trying to figure out what was going on for 1 year. And then I referred him to a pediatric psychiatrist, and she called me and she was like, Felix, he's autistic, didn't you see? And we had a good connection, but I didn't really figure out what was the problem. So there's always, it looks like there's always some kind of connection, which I don't really can describe. On the other hand, sometimes I see it, sometimes I don't see it. Sometimes I think it might be the case, and then it's not the case. So we discuss it together, and when we think it might be the case, then we do the testing at the psychiatry.
Mm-hmm. So let's shift to a complementary area of expertise that you have, and that is neuroscience. So could you explain how that happened with, I don't know, did it happen before your medical training, concurrently with your medical training? And how does your doctorate in neuroscience kind of impact you in your practice of being a pediatrician?
Yeah, but when I was starting the medical school, when I was quite old, 29, but still it was a lot, and that's also a positive thing. I was very much depending on the safety of logic and cognition, so that felt very safe for me. So
Mm-hmm.
the safest cognition place maybe is the brain. So I really wanted to be at the neuroscience institute, and we could choose for scientific practice. We had 10 places we could choose. I would choose 1 to 10 was the Neuroscience Institute. And then I was invited to go there, and I was quite afraid because I never had this feeling it's okay. I also never had the feeling that I know anything. I always felt like the most stupid guy in the medical school. I thought always I was the only one that didn't get it. And so I went there with I was really sweaty hands and very nervous because I thought after 5 minutes they would discover that I don't understand the brain at all. They would kick me out. So I was sitting there and I had this wonderful conversation with my who would become later my supervisor for my PhD thesis. And when we were finished, I had this really stupid question, so naive. I asked him, please, can you advise me some book or something? Because I did so much my best at neurology. I really have the feeling I don't get the brain at all. And then he stood up, shook my hand and said, welcome in the club. That's exactly the thing. That's exactly the feeling I have. And that's the reason why I'm in the institute every day. And if you can keep that kind of mental attitude, then you can become a neuroscientist. So
Yeah. The brain doesn't understand itself. It doesn't matter whose brain.
exactly. It was such a wonderful place. You could. It was the director was Dick Swaap. He's a famous Dutch neuroscientist, and my supervisor was Ruud Buys. And it was such a safe place because you might ask everything. You might on Monday morning you might ask, why are we doing that? They would love it, but you never were allowed to. How do you say it in English? To pretend that you know something you don't know. That was never accepted. They would directly tell you, even in front of the public. It was not accepted. It was very nice area. And what I learned was exactly that the brain is a little bit complicated. So really know that we will never really understand the brain. And that is a wonderful thing because that means that you could discover forever. It will never stop. So I did some research on the basic functions, the hypothalamus. The hypothalamus is kind of the central computer for everything we need to survive, breathing and fluid drinking, energy. And I really learned and actually I wanted to do that research because I understood that that's about the autonomic nervous system, and it makes your eyes pupils small or big, and makes your heart going fast. It makes you sweat or not. If you are in a dangerous feeling, in a bad feeling, or in a good feeling. And I thought that's interesting that you could recognize somebody's mind by these signs. Now I think it's also because at that time maybe it was not always easy for me. I had a hyper focus on that to understand that how somebody feels through this kind of signs. And then I worked on that, and I learned some of the basic functions of the body, and I learned that it's really difficult to understand the brain, and that's also important for neurodiversity. That I think it's really important that you are very open to what you see. Everything is fine as long as you're not really believing that you know what's going on in somebody else's head. Actually, I think as an autistic doctor, I'm not a bad doctor because I don't assume what somebody is thinking. I just don't know. So I ask and I keep asking. And that's actually something which is working not too bad.
Yeah,
And,
I one of our friends who has sadly passed away, Steve Silberman. I heard him during one of his presentations say
I
that
love the
there's
book Neurotribes. I love it. I love it.
it's the best, isn't it? Like it's and
Oh, yes.
it's
And
so well researched.
my parents also love it a lot. Yeah. When I get
Yeah.
it. Yeah.
So you're prescribing essentially this, or you're recommending
Yes.
this reading
Yeah.
to the families.
Uniquely Human and Neurotribes. Those are the two books I feel that they should read.
That's all you need. That's the Bible. It's the New Testament, Old Testament. It's like it's the whole thing. But so Steve, during one of his presentations, put it so eloquently. I thought he said, "There's this. If you're approaching autism as though it is a failed version of normal, then you're looking at it in a very counterproductive way." And that's what it sounds like your gift that you're bringing to your patients, to the families, is I'm going to meet this individual where they are at, how their brain works, its factory default settings, and how that informs what's going on in front of me now, how that informs the panic attacks, the dysregulation, the GI pain. You're meeting the human where they are.
And that's so much fun to look for the strengths of a child. And I don't know exactly what you meant on the ED, but it triggered me because I think what should change is that we look only at the problems at neurodivergent children. It's happening much too much. We are looking only at the problems. And we are and because I really believe we don't know enough of the natural development of neurodivergent children. Because very often something is not working. So an autistic child, like 12 years old, is getting in trouble into school. And they're coming to me with belly pain. And then I'm really looking forward to it because I think, probably that child is starting more and more the emotional development, which is confusing. And the situation at that age at school might be confusing, but it's such a big chance because the positive thing is the emotional development really started now. It's really starting now, and it will be a wonderful journey, and it will go throughout adulthood. That's how I approach it. And the belly pain will be a very important kind of gorg or kind of thermometer. I don't know in English how to say, something to measure how you feel. The child is actually learning how to feel. And so I'm very enthusiastic when they are coming in with belly pain. And of course, my job is to make sure that the organs are safe. That's always something you do in the first step, to make sure that there's not something going on with the organs. But then 70-80% it's not. And then we have so much beautiful things to work on. And if you approach it that way, it's so much fun to do outpatient clinic because I see every 50 minutes, I see wonderful children with so many, it's so surprising. Every time I'm there like, what will happen now again? I never know before. It's always surprising. That's really fantastic. And that's what we should do more. So the first time I see a child, I always ask them, name me 3 things why your parents next to you should be really happy that you are the way you are. And I'm so sad because a lot of teenagers who cannot name one thing. It's too much. And then you hear kind of almost mental professional language, what the problems are. And but also more and more children know the positive things. And that's always, then they feel good to go. So I think so sometimes I think, is it really like hospital medicine I'm doing, or am I trying to protect a child to do their normal development? So I feel like the emotional development, for example, in the teenagers, it's in them and it will get there out of it as long as we make sure that there's a safe space and they can develop in the natural way and that you cannot squeeze it out or pull it out. Sometimes you just have to wait and to stimulate a little bit and then it will happen. And that's so much fun to see that growth. I feel so privileged to have that as a job.
You make such an important connection, Felix, which just kind of triggered this thought in my mind that when you're looking at a child's emotional development, and okay, let's give the example of a child with belly pain again, that may be happening at the point that that child is becoming so much more self-aware, maybe self-aware of how they are different from other kids, maybe when they were very young, being bullied was, okay, I don't really process that. But now I understand that these people are being, or these other kids are being mean to me because of how I behave or how I speak. So that self-awareness, which would be the natural emotional growth, may actually be a trigger for some medical issues that are caused by stress.
Yes, exactly. And that's it's so good to help them to learn to feel. So even if the feeling now is bad, you can turn it around. And also, not all of them, it's very different, but a lot of children at that age, when they start to get their emotional development really getting faster and faster, they also got stuck. For example, it's an example because of masking. So before they could mask, and they would learn to do exactly what the opposite person wants from them, and then they could survive. It's an important skill, but it can work against you. And then and when you get older at school, a lot of different people want different things from you, and the teachers want different things, and then they got stuck. So very often it is for them to learn what they feel, and an important thing is to learn for them to know what they need and to tell it to the surrounding, and also demanding from the neurotypical world. We ask them friendly, but in fact we demand because it's a right that small adjustments are made. Very often it's not a very big thing, but sometimes it is. But very often it is not that complicated. It might be small things like being allowed to go to the toilet whenever you need it immediately to do. Being allowed to get a quiet place for a half an hour if you get overwhelmed. All these kind of small things can help a lot.
Yeah, I really appreciate what you're saying about understanding what you're feeling. And it's two things. Feeling can be what your perception is of a physical sensation, pain, itchiness, whatever, but also the feeling what your feelings are and being able to allow the emotions to exist without feeling so big that you become the Edvard Munch scream painting, which happens to me on probably almost a daily basis for one reason or another. Barry has seen it a couple times where I just lost my mind and, railed against something, but it's so vitally important. And it's interesting. So my daughter has been dealing with exactly what you're describing, which is much like me, everybody's on a different emotional sort of growth trajectory. And I always felt personally that I was maybe 10 years delinquent behind my peers, my friend group, in terms of when they were 23 years old, they were out there in the bars drinking, having a good time. When I was 23 years old, I was still just figuring out, okay, what combination of foods can I eat that don't make me feel too sick to go to work the next day? And all I wanted was my own comfort, and my world became very, very small in my early 20s. So, and now I'm noticing too with my daughter the same thing, that I think you're right. The awareness of this sense that you're not like the other children in these kind of pretty notable ways, that adds an extra layer of burden. So not only are you having to, let me phrase it this way, not only are you not feeling like you're fitting in and sort of aligned with your peer group and your cohort, but then you go to the clinic or to the hospital or to the doctor's office, emergency department, whatever. And the frustrating thing is they will do all the physical tests that they know to look for obvious things, and all the tests will come back normal. You're perfectly normal. You're having intense pain that's keeping you in bed in your stomach, and every time you eat food, it feels like you're digesting fire. But nope, you're fine. You're totally normal. And that is incredibly frustrating for the patient, because then they're feeling like, well, does anybody believe me that I'm actually experiencing this? But also for the family members. And I think it's a very difficult position for any medical or healthcare professional to be in, is to look at somebody and say, physically, you're perfect. I don't know why you're experiencing tremendous pain and have no answers.
Yeah, and exactly. So it can be very frightening to tell somebody, "Oh, good news, you are fine. You're lovely."
Yeah.
That's really where the panic starts, because then somebody even doesn't see your pain anymore. It's like neglecting your pain because it's not in lab. It's not done by that's of course how medicine for a part works. So what I experienced is that I asked them, what is really important for you? And what's really important is to get rid of the pain. So, and then when I tell them, I won't leave you until you are better, I will stay with you and I can help you. That's the most important thing. First, we make sure your organs are fine, because we don't know if your organs are fine. The chances are low that there is, but we have to take it seriously. So with autistic children, I do much more tests than with other children, because you cannot really trust the pain experience. You cannot trust that they can easily explain what they feel. So to be safe, I do more testing, but I do it fast in the first part, and then we make a plan in advance. We agree together which tests should be done, which are needed, because if you're a parent and your child is in pain for 2 years, you have been Googling and looking for explanations. That's so natural. If you love your child, you will do it. And so we can negotiate. If I also do tests, if it's not very difficult, I will take them. And then I tell them that probably all the tests are fine, but then we start to heal. Then we work on it. And if you do it that way, most patients and children are very much willing to get the help. So sometimes it gets wrong because the patients and the parents want to get rid of the pain, and they ask, for example, for a scan, and then there's some discussion about the scan and kind of a fight if somebody should be scanned or not be scanned. And that's not what it is about. And then sometimes I hear that my colleagues have this misunderstanding, and they do their best, but sometimes they misunderstand and they feel like, this parents drive me crazy because they want a brain scan. They don't want a brain scan. They want to get the child better, and they want it to be safe. And there are different ways to get there.
You know, it's interesting. I was just thinking of asking you about kind of the major shortcomings that you see in supporting autistic and neurodivergent kids coming in, but you kind of alluded to that already, that maybe if a child who's on the spectrum or who's otherwise neurodivergent is just treated like any child, and they don't get the further exploration that you're talking about or the extra time that you're talking about, then you could really be missing some things very clearly, especially for kids who cannot identify what they're feeling and where they're feeling that. So you have to play much more of a detective as a physician, and bring in much more information from the parents and maybe more examination, or a more detailed examination. And I think that's a great recommendation for, people who are listening, whose kids go into emergency medicine situations. And I don't know how that could be gotten into the training of doctors in medical schools, because from what I understand, including my own son, is that there's not a lot of training about maybe the special differences in serving autistic and neurodivergent kids.
Yeah, we try to talk about this with our medical students, and they really are very hungry for that kind of information. And especially if you're open, if you tell them, also don't know exactly. We don't know. But as long as you know some basics, read 2 books, read 2 books, and then you just listen and observe carefully, and you listen to the parents and to the children. And if you develop then a hypothesis and you check it with the parents and the children, not so much can happen. Probably you are the best expert ever within a few meetings.
Yes.
It's actually really easy to become an expert in this area. You just have to listen. And if it's not going the way you want, to listen again. And then you're also safe if you make a mistake.
Yeah.
Yes, and creating a safe space for advocacy on the parents' behalf. Again, my own personal example, earlier this year, our daughter had her first of a series of hospitalizations that lasted 2 weeks or longer because her pain and nausea in her stomach were so intense that she could not eat or drink anything. And the first doctor came in and said, well, we see this a lot of times with teenagers who don't want to gain weight. She's just got to start eating. That's all. Okay, bye. And he just blustered out of the room. And my wife stood up, followed him out, and said, don't come back here ever. And she talked to the nurses, and she said, we don't want that doctor to come in here ever again. Right. And so then the next round of the hospital respected that. And the next doctor came in and said, so what's going on? And listened for 45 minutes and then tried to do some detective work. But that's the difference between advocating for yourself and then just blindly trusting the opinion of somebody who didn't even take your circumstances into real consideration.
Yeah. And it's also much more fun to do it, to do it that way. And that's very old-fashioned, simple, basic of compassion and listening to somebody. And the nicest thing is, when I started, I put so much energy to trying to fill in what somebody was thinking and what I should do, and that I should solve everything. And with this kind of, when I walk in like that, I'm so relaxed. I get energy from it. It doesn't cost any energy because you just have to listen. It's actually, it's not only that simple, but in a way it is simple. And the advocacy is really important because also my hospital, we tried so much to have a neurodivergent friendly hospital, but sometimes really bad stuff also happens. And I was so sad. We worked so much on a family with an autistic boy. He had a lot of testing and he needed a new test. And then we thought that we prepared everything, but it went wrong. And then they asked the parents to hold and restrain their boy. And I called the father afterwards, and he was so sad. He said to me, like a few years ago, I promised myself to never let my son down again because it happened when he was younger, the restraint for blood testing. And then I just did it again and I let my boy down. That felt so bad. So it's very sad if we don't do it in the right way.
It's I need to say that it does my heart good because, and especially in educational settings, both myself and my colleagues were very family centered, and it sounds like it's such a part of your DNA that you understand that supporting families, seeing families as experts on their child, maybe not an expert on autism, but experts on their child, that's the bottom line for you. I mean, and it sounds like when you said, and it doesn't expend any energy, it sounds like it actually energizes you.
Exactly.
You really feel you're connecting. Yeah.
Yeah. Yeah. They say so nice and interesting things. I don't know, can I share two examples?
Sure.
So one of my favorites, so you sit there, I'm doing my job, and then for free you get remarks like that. Like one boy, he's 13, he said, all of the sudden, without any introduction, autistic boy, he said, the worst thing is when they sigh. It means you have done something wrong, but they don't look at you or say anything. You have to guess what it is, and if you don't guess it, they get mad at you. So this is such a brilliant description of neurotypical and others' behavior. Talking about behavior, difficult behavior. This is difficult behavior. I really, I get this for free. Or another boy, he is 12, and I asked him, how's your school like? He said, I'm really bad school. It's really bad. I said, why? He said, well, I believe that if humankind should go in a better way, then we should know everything about international conflicts, because we should prevent wars by knowing everything about the conflicts of the past. If we know everything, then it won't happen again. And I thought that was fantastic. He knows everything about conflicts. But my school doesn't let me tell what I know. And I was like, that's strange. And then mother told me it's an international school. So in his class, you had Pakistani, you had Indian people, you had Russians, you had Americans, Germans, every next to each other. But that was such a nice moment, because I thought, now we can help him to get his emotional development. So I explained to him, you have two professions. One is political science. You are the best in that. We really need you. It's your role. And that's also something positive, maybe about being neurodivergent. You are fantastic. But to get that to people to accept it, that's something different. It's called democracy. And it's not about knowledge, it's just about emotion. How much you have to feel, how much you can tell to somebody in which way. But you could make a profession from that, and then you will start to work on your emotional development. And maybe you can start thinking of every child in your class. If that child, because of their background and family, maybe somebody got hurt in that part, and we're in their past, and maybe you can think how they will experience your talking about a certain conflict. And this kind of things is so much fun to do. And he understood directly what I meant. He really understood. So and now he would do it his way. He will be probably an expert in diplomacy. He's reading book. I said this guy is called Kissinger. He wrote it. And then he would get the book immediately.
This guy.
It's like you were giving him a lesson in perspective taking. Okay, I'm expert on conflicts, but people will see it. Your fellow students will see it in very, very different ways, and you need to understand that. And of course, on this show we talk about enthusiasms. I've never heard of a youngster whose enthusiasm was conflicts.
or diplomacy.
Felix, as you said, we could all learn from that. Absolutely. So what advice would you give to parents? Because you're speaking so much about helping parents be good advocates for their kids. So what advice would you give to parents as well as other medical professionals in terms of just better serving autistic and neurodivergent kids in medical settings?
Yes, I think what could help several things. Like one is, but maybe that's so what I start again. Maybe most of the parents already do it, but find some parents who have also maybe neurodivergent children, because maybe they're the only ones who really understand you. Then figure out, and it might be helpful to have at least one health professional who has compassion with your child and your family, to have kind of an anchor where you can fall back to. And then it's really important to know what you want. Make sure that you know what you want. Just maybe you can write down on a paper, what is something I want to achieve for my child, in every healthcare contact. And what are no-goes? I don't want that will happen to my child.
Mm-hmm.
And you just tell them, and they have to deal with them, but you can do it in a friendly way. But if you do it before and not in the where something has to happen and everybody is stressed, it can work a lot. So that might help. Maybe I hope that helps. And having this kind of, this is the way you handle my child in a certain situation, that also can help the health professionals to explain them. Because all my colleagues, everybody really tries their best, but sometimes they don't know how to do it.
Mm-hmm.
I would agree. I would think that all the years of medical school and even the impetus to take on that body of work, no doctors are showing up because they want patients to feel bad. Nobody wants to do their job poorly. So it's more about guiding them, like you said, towards that understanding of the autistic or neurodivergent experience to inform how they engage with them.
Yes.
Yeah.
I'm struck by, what you just said, Felix, is it's so similar to things that I often recommend to parents around school issues. Speak to other parents. Maybe they've been down the road a little bit ahead of you, get their advice, seek allies, go for that teacher or that administrator who gets your child and you can work with that person. Just so important. And be very clear about what you want for your child and also what you don't want to happen. That's wonderful. I'm always struck by the parallels of what really works in supporting kids and families, even though you're dealing with a very different kind of structure, agency, or organization. Some of those themes are just so parallel. So, Any last words of wisdom for us?
I was wondering why we maybe get more diagnoses of, for example, autism and ADHD. And I have this idea, maybe if you think of a group of all the whole humankind, then the majority of the brains work different, but still more similar than others. And that will be my definition of neurotypical, the neurotypical group. Because they are the majority, they build the world, of course, which is normal. I don't feel angry about it. That's just the way it's logical. They build it their way, and sometimes they forget that not everybody likes it that way. And I think because we are in such a highly developed civilization, almost really high civilized, that all the small parts of this world, which is the neurotypical words, gets more and more developed. How a baby should react, how a toddler should, what they should learn. And the crazy thing is that the individual things which are done, how to educate babies and children, I totally agree. I like it. Actually, I try to tribute to them. But the consequence is that the world is so much, it's more strict and less fluid, because about everything, somebody thought about it. And I think that might be a reason why neurodivergent people struggle more, because it's more rigid, less fluid. So I don't think we have to go back in culture or civilization, but I think then maybe we should try to make where the neurotypical world and the neurodivergent world is going together, to make that more fluid and also demand some room back from the neurotypical world.
Exactly. That's so well put. If you were a farmer and you were planting seeds in the ground and only 80% of your crops come up, if you're expecting 100% of all the crops to mature and blossom into crops for harvesting, then your system is what is failing, not the 20% of crops that failed to pollinate. You need to address the system or the expectations. Yeah.
Yes.
Exactly. Yes.
And ideally, isn't that part of the mission of the neurodiversity movement, to really help us understand that blending and that continuum, rather than compartmentalizing and putting people into different blocks and categories based upon how they behave, how they express emotions, how they think, how they talk, and so forth. And I think it's professionals such as you, Felix, that are in some of the most challenging situations for kids and families that are making this happen. And so congratulations on your work, and thank you for joining us from across the big sea.
Yeah. Thank you so much for having me. It was really nice to talk to you.
Yes.
Oh man, we are better for it. And I will say this, my maternal grandmother's family name is Zvort. So I'm Dutch, and partially,
really?
yes. So
oh yeah, you're welcome.
If you think the Netherlands would like a fellow Dutchman, I will wash your dishes. I'll clean your car. Any jobs you can give me, I need to get the hell out of here.
You're welcome.
All righty, guys. Felix, thank you so much, and I look forward to seeing you if you make your way across the big lake this coming summer. So yes,
I will. Okay, thank you so much. Thank you, Dave.
Thank you both.
Bye.
Bye.